Good afternoon, ladies and gentlemen. Welcome to the session Kuka for Sustainability. How can we travel without creating a negative impact for the environmental ecosystem? How can we produce without consuming all the resources so that our future generations still enjoy the prosperity as we had? I think those are the very critical sustainability topics involving ecological, economical, as well as all the social issues. Today I had the opportunity, together with Johannes, to highlight our commitment for sustainability. For sustainability, it requires all the private citizens, corporations, as well as governments around the world to tackle the issue. So when we look at... excuse
Hello,
me.
they need... Can you move the slide? Hello?
Sorry. When we look at our commitment, our first commitment is toward energy efficiency. So when it comes to energy efficiency, it's not only about the production energy efficiency at our own factories, at our own office, but it's also about energy efficiency for the production that our robots went producing. Toward the first aspect, all the energy that we use at Kuka in our headquarters in Germany, 100% green energy. It's also that we are on the way to support the EU overall CO2 reduction toward 2030. On the second aspect, that you may know that when a robot working in a manufacturing environment, 40% of its life cycle cost is about energy. And over the last 10 years, Kuka has reduced the energy consumption of our robots by 60%. That's 60% out of the 40% for a robot out of a lifetime. And directly and indirectly, we are also contributing in production of batteries in the new energy vehicle, as well as solar panels as a new energy source. Most importantly, that we are also expanding the technology horizon where robots are used. Traditionally, robotics are married with automotive industry, but today robots are used also in, you have seen all different robots in this summit here. Our robots are also used not only building batteries, but also building houses. And our second commitment when it comes to sustainability is about supporting the healthcare for human society. And with that, we have the first and still the only medically certified robot, LBR MET. And with that, it's well integrated into different medical systems. Today, I also have the pleasure to introduce Johannes Schaeferhoff. Johannes is the CEO of ROPCA, and ROPCA is the winner of the Robotics for Good Innovation Factories. Congratulations, Johannes.
Thank you. Thank you very much.
So, can you tell us a little bit about your robot, Arthur?
Yes, absolutely. I'll just quickly switch over here. So our robot Arthur is the world's first autonomous ultrasound robot scanning for rheumatoid arthritis. And it is a robot that is packed with AI. AI and robotics is really like a synergetic relationship because the robot could not be autonomous the way it is if it wasn't for AI. It's AI that enables us to scan all these different patients for rheumatoid arthritis, and it really makes a huge difference because without it, we would always need human operators. So this is really an important thing here to combine AI and robotics. In terms of the award, I would also like to say again thank you to Kuka and thanks to the AI for Good. We were really proud to be acknowledged as the leader and winner here in this finale of the Innovation Factory. And I think we can make a huge difference to society when we use AI in the future in healthcare, because there are many opportunities where you have non-invasive procedures, such as ultrasound in our case, where you can actually use computer vision to land, in our case, an ultrasound probe and scan the hands of patients, and then use AI again to evaluate the images and detect rheumatoid arthritis or other diseases that we want to detect in the future. So we believe that using our robot, we can massively reduce the weights that patients currently experience. And currently in Europe, the average weight for the diagnosis of rheumatoid arthritis is 6 months, and this is a really aggressive disease, and you already suffer from bone erosion after only 6 weeks. So there's huge potential to cut waiting times and help more patients. So I think this is really like a very good early application. There's also many other applications that the LBR Med can be used for, and yeah, we met a few as part of our journey with the award.
So Johannes, can you maybe tell us a little bit, your customers and the interesting applications that this robot has been used and being deployed?
Yeah, so we have currently 3 hospitals that are using the robot in Denmark, and we have many interested parties in top research institutions across Europe. So we have interest from the major research hospital in Germany, in Austria, and they value this really highly because ultrasound is commonly understood to be the most benign modality in imaging because it is non-invasive. There's no what's it called? Whatever. Yeah. Anyhow, it's non-invasive, it's really cheap, it's mobile, and it can perform on many body parts. And previously, ultrasound was always understood to be user-dependent and to be inconsistent and subjective. Now, with the arrival of AI and robotics, ultrasound can, for the first time, be made consistent and objective, and that's a really, really big step forward. And it is also a big step forward for the doctors and also for the pharma companies, because what they definitely want to have is an objective assessment when they make a change from one drug to the other.
And I find it interesting that, for ROPCA, you married the robotics together with ultrasound, with AI, addressing a particular health issue. And why do you think that arthritis is such a big kind of issue for human society?
Yeah, rheumatoid arthritis is a huge issue for society. It is because it is a chronic autoimmune disorder, and it affects people all their lives. So while only 1% of the population suffer from it, it actually means that these patients need monitoring and help all of their lives. And the drugs you use for this condition are really powerful drugs. So you need to always make sure that you get the dosage down as far as possible. And for that, you need constant monitoring. So that's why we think that this is a great system for this purpose, because currently the patients typically never get an appointment in time when they feel an inflammation is coming. So with the arrival of Arthur, that will change.
I understand that your vision for Arthur is to be universally accessible in all retail locations.
Yeah.
That is probably a little bit difficult in a country like Denmark, but how do you see that around the globe?
Yeah, we believe that that Arthur could be accessible as a self-service station in any kind of public area, because we are only scanning hands, and there's, to our knowledge, no culture in the world that has a problem in exposing their hands. So we think that Arthur could be accessed in pharmacies or in shopping malls. It could stand in many public places and offer its services there. So, yeah.
In this scenario, can you help us to understand a little bit why you choose this robot in particular?
Yes, absolutely. So Kuka helped us a lot in creating Arthur. Kuka has, as was mentioned, you are the only company with a medically certified robot that can be programmed for multiple purposes. And this is a huge advantage because it helped us get Arthur to the market and certified within a year according to the MDR in Europe, which is otherwise next to impossible. So Kuka provided really, really good documentation and certification that really sped up our process. And that's key. You know, we wanted to be first to the market, and Kuka made that possible.
What is the feedback reaction when using this kind of device with different customers or patients? Are they afraid of the device with moving parts and everything?
No, they're not. I don't think that they are afraid. When we tested it with patients were overwhelmingly very, very positive towards it. 92% wanted to have Arthur as part of their routine. So that was really positive. The only sort of fears that we are encountering with Arthur is that oftentimes, especially nurses, are worried that their technical expertise might be insufficient if there is an error. But otherwise, there's very little fear around the product. So,
very good, very good. So I hope that you enjoyed our session. Again, this is Kuka together with ROPCA for sustainability, addressing not only energy efficiency, but also healthcare toward human society. Thank you very much for attending.
Thank you.